Hi guys, Kate here, one of our physical therapists at our East Norristown location. In honor of the Philadelphia Phillies making it to the playoffs, I was going to go over some of my recommendations for throwers, pitchers, baseball players, and more specifically, anybody having issues with pain during throwing. So there's two big things you want to look out for when you are having pain during throwing. The two biggest reasons why people usually have pain is, number one, a lack of mobility in the back of their shoulder blade. So an easy way to test this would be arms up here, down, and back. Okay, what you want to see here is pretty symmetrical range of motion. What you may notice on the side on your throwing arm is this arm goes down nice and easy and this arm's sort of stuck here. What that indicates is tightness in the back of the shoulder blade. Another quick way to test that is reaching behind the back, okay? So if this is my pitching arm, what you're gonna notice is on this side, it should go up nice and easy. On this arm, it's gonna be stiff and tight and you're not gonna be able to bring it up as far. Both of those two things are indicating tightness in the back of the shoulder blade. An easy way to address that, arm across and stretching, okay? General rule of thumb with stretching, 3 times, 30-second hold. Make sure that your shoulder is staying out of your ear. It's nice and relaxed. And what you should feel is a nice little pull in the back of the shoulder into the shoulder blade, okay? So that would be the start of the progression. You could even do a stretch over the head, which also will kind of get the back of the arm, back of the shoulder to stretch that out as well. 3 times, 30-second hold. The second reason why people usually have issues, pain with throwing is strength in their rotator cuff muscle group. It's very common that this muscle group is very weak. With throwing specifically, this is the most important muscle group to be strong. So it's important that you're doing isolated muscle strengthening to the rotator cuff muscle group. So there's a little progression of 4 different exercises, easy to do before a game. So you would start out with your stretching, and then you would do your rotator cuff strengthening exercises. All you need is a band. With all of these, posture, very important. So you want to make sure chin tucked, shoulder blades back, everything's sort of stacked on top of each other. And what you're doing is rotating in and out. You're trying to go through that full range. Start at your stomach and pull out as far as you feel comfortable. If you have any pain through this range, keep it in a pain-free range. I always tell my patients, you're in control of how far you're moving. So if there's any pain through this range, modify it. Don't go as far, okay? So 10 times. Next one would be out, up, and back. All right, here, trying to keep your wrists and elbow in a straight line. My wrist is stacked directly on top of my elbow as I do this movement. My chin stays tucked, my shoulder blades stay down. So 10 here. Then face the bands here, rotating back. Chin tucked, shoulder blades stay down. 10. And then the last progression would be here and pressing up. Okay? So just to go over theirs again. 10, in and out. 10, up and down. 10 back. And then 10 back, press. Okay, all of those exercises really focusing on the back of the shoulder blade. You're going to feel a lot of burn, a lot of fatigue. So if you can't get to that 10th repetition, start at 5, and then maybe in a couple days add a rep, okay? But if you notice any pain or if you notice your form is losing where it should be, stop. Okay, the goal would be to get to 2 or 3 sets of 10 of each of those movements, but you may need to start with 5 reps of maybe 1 or 2 sets depending on how the shoulder is feeling, okay? With these exercises, there is a lot of technique and form involved in them, so there's a lot of room for error. There's a lot of room for compensation. That's what we're here for. So if you have any questions about any of these exercises, if you're unable to get through this progression because everything starts hurting or maybe this is aggravating things more, give us a call. But otherwise, good luck. I hope they help.